32-year-old woman presents with exertional dyspnea. Auscultation reveals a mid-diastolic rumbling murmur heard best at the apex. What is the most likely diagnosis? Mitral stenosis. The condition is characterized by the narrowing of the mitral valve, leading to decreased blood flow from the left atrium to the left ventricle. This can result in increased pressure in the left atrium, and ultimately lead to symptoms such as shortness of breath, fatigue, and heart palpitations. Management may include medications to control symptoms, monitoring for complications, and in some cases, surgical interventions such as mitral valve repair or replacement.